Signs of a stroke. We commonly hear about symptoms such as weakness in one arm, difficulty walking, or slurred speech. While these are certainly signs of stroke, in reality, the face is very often the first place to reveal a problem. If you pay very close attention, just a few seconds of observing the face could be enough to save that person's life. One side of the mouth might droop, one eye may not blink evenly, or the right side of the forehead might not wrinkle. These seemingly small changes are, in fact, the brain's earliest and most direct warning signals. Emergency doctors across the United States consistently agree that spotting changes in the face early is one of the most critical factors determining how well a person recovers after a stroke. This is because, as research from the National Institutes of Health has shown, even a mere 15-minute delay can lead to the loss of millions of brain cells and damage that, once incurred, never truly heals. Inside your brain, there's a complex command center that sends electrical signals to every part of your body. The specific part of this command center that controls the face muscles is located quite near the surface of the brain. This is the region that orchestrates your ability to smile, to blink, to wrinkle your forehead, and to press your lips together. But there is a crucial and unique aspect to this particular area. The signal pathway from this part of the brain to your face muscles is remarkably short, and critically, it has no backup routes. This means that even a very small blood clot, if it blocks the blood flow to this precise region, can instantly stop the signal, causing the face muscles to lose control right away. This is precisely why stroke symptoms can manifest in the face within the first 3 to 5 minutes. In contrast, the arms or legs have more elaborate and redundant nerve pathways, meaning they typically take a longer time to show noticeable changes or weakness. The part of the brain that controls the face receives its blood supply from a branch of the middle cerebral artery. This artery is unfortunately one of the most common places for blockages to occur. Studies from the National Institutes of Health in the U.S. indicate that over 60% of strokes caused by reduced blood flow happen in the areas supplied by this particular artery. When the blood supply to that vital part of the brain is cut off, oxygen cannot reach the brain cells, and in just a few minutes, one side of the face becomes disconnected from its command center. This is why, if you observe someone who can still talk, who is still awake and seemingly aware, but their smile suddenly appears crooked, it may be a clear sign that their brain is in serious danger. Many people mistakenly believe that a stroke always means you cannot lift your arm or you stumble when walking. While these are indeed stroke symptoms, they usually appear later. The muscles in the arms and legs have long nerve pathways with multiple backup routes, but the face is different. It receives its signals from the brain primarily through one single nerve, the seventh cranial nerve, which is highly responsive and reacts very quickly if that signal is lost. That is why, according to research published in Stroke, the Journal of the American Heart Association, in more than 70% of sudden stroke cases, the face is the very first place to show something is wrong. The brain area affected by these types of strokes does not just control the face. It also plays a vital role in speaking, pronouncing words, and displaying emotions. This explains why many individuals experiencing a mild stroke still seem awake and aware, yet their speech might be unclear, or they struggle to show emotions as they normally would. Doctors often refer to this as the golden triangle of a left brain stroke: a crooked smile, unclear speech, and eyes that appear distant or sad. If all three of these signs appear, there is a high probability the person is having a serious brain blood flow problem, and you must call 911 immediately. According to the Centers for Disease Control and Prevention in the U.S., more than 795,000 people each year experience a stroke. Approximately 610,000 are first-time strokes, and 185,000 are repeat strokes. Among these, nearly 80% show symptoms in the face, and 72% show signs within the first 15 minutes, according to the journal Stroke. For every minute without help, the brain loses approximately 1.9 million nerve cells. If you notice a change in the face and act within the golden window of the first 3 hours, the chance of a full recovery is remarkably high. This is why early recognition is not just important, it is absolutely paramount. Now, it is also important to briefly discuss Bell's palsy, a condition where the face muscles become weak due to nerve swelling. It is usually harmless and often improves within a few weeks. However, its signs can look very much like a stroke, leading many people to mistakenly ignore them. Here is an easy way to help tell the difference. A stroke that starts very suddenly usually affects only the lower half of one side of the face, may come with weak arms or legs, and often includes unclear speech. In such a case, you must call 911 immediately. Bell's palsy, on the other hand, typically starts more slowly, over several hours or even days, causes weakness in the entire side of the face, and usually does not affect the arms or legs. Bell's palsy can be watched closely with medical advice. If you are ever unsure, my advice is always to treat it as a stroke and call 911. Being careful is always better than being sorry. Your brain and your future are too precious to gamble with. Many people, particularly older adults, often attribute light signs on the face to benign causes such as being tired, poor sleep, or even the way they slept. Some might think they simply caught a chill, while others believe it is a minor nerve issue, and, tragically, they choose to wait. This common mistake is a significant reason why thousands of people in the U.S. lose their ability to speak, walk, or live independently every year, all because help arrived too late. A crooked smile is never just a small thing. A drooping cheek is never just because of tiredness. A slow, blinking eyelid might be your brain, or the brain of someone you love, urgently asking for help. You do not need to check blood pressure. You do not need to know the heart rate. Just look carefully at the face for 5 seconds. That brief observation could catch a stroke starting, right then and there. Consider the timeline. If you wait 0 to 5 minutes after symptoms begin, the face starts to change, the cheek droops, and the eyelid lowers. If you wait 5 to 15 minutes, speech becomes harder and the eyes may appear distant. Confusion begins to set in. If you wait 15 to 30 minutes, millions of brain cells die, the arms or legs may lose control, and a mild coma could follow. If you wait more than 30 minutes without getting to the hospital, the chance of death or permanent damage tragically doubles. The face is the fastest and clearest signal of a stroke. Watch for 4 critical points: the mouth, the cheek, the eye, and the forehead. Do not wait. Do not guess. Do not ignore it simply because they are still talking and seem otherwise fine. These signs on the face can absolutely save a life. But sadly, many people over 60 either do not notice them or, for various reasons, choose to ignore them. Why does this happen? You will understand in the next part. And if you are over 60, or care for someone who is, this next section is specifically for you. Right after this, I will share the 10 common and often heartbreaking reasons why older adults frequently miss the early warning signs of a stroke on the face. Just by understanding each of these reasons, you are already taking a monumental step ahead of the risk, arming yourself with knowledge that can protect you and your loved ones. Let us dive into these crucial insights. Reason number 1. They feel fine even when signs are already there. It is a peculiar and dangerous phenomenon. When experiencing a mild stroke, many older individuals simply do not perceive themselves to be in danger. They do not fall. They do not experience a strong, pounding headache. They do not faint. They can still converse, still hear, and even get up and walk around. So, almost immediately, the familiar and reassuring thought enters their mind. I'm fine. But here is the critical truth. That fine feeling can often be a deceptive illusion, especially in people over 60. As we age, our nervous system can gradually lose some of its acute ability to clearly sense small problems. This means your brain could already be critically low on blood or even damaged, and you would not feel any pain, discomfort, or even significant tiredness at all. According to research from the National Institute of Neurological Disorders and Stroke in the U.S., an astounding one in 3 older people who experienced a mild stroke never even realized it happened. They only recalled that their mouth looked a little off, or they slurred a bit, but took no action. A few days later, when the true diagnosis was made, it was often tragically too late to reverse the damage. I once met a patient named Thomas, a 68-year-old gentleman living in Texas. He developed a slightly crooked mouth and was speaking slower after some afternoon yard work. His wife noticed it, but Thomas confidently stated, "It's probably just a little wind chill," then sat down to drink some water. 2 hours later, he could no longer speak. When they finally reached the hospital, the doctors explained that he had indeed suffered a temporary stroke, but because he waited too long, the damage had spread to the speech center, and he permanently lost his ability to speak clearly from then on. This harrowing story underscores why feeling okay is simply not enough. With stroke, the feeling of something being profoundly wrong often lags behind the actual damage. If you wait until you feel truly unwell before you act, you may forfeit the golden opportunity to recover. Just a slight bend in the mouth, a word that comes out a little slurred, one subtly drooping eyelid. If even one of these signs appears, you must consider the possibility of a stroke. Do not wait for the moment when you feel bad. Reason number 2. They are afraid of bothering their children or neighbors. This is a very common and heartbreaking reason among older adults, particularly those in America and Europe who have lived independently for many years. When they start to notice a slight bend in their mouth, a fleeting trouble speaking, or one eye not opening quite right, they might recognize that something is amiss. But instead of immediately calling 911 or alerting their children, they choose to sit quietly and rest, hoping it will simply go away. Some might drink a little water, while others tell themselves, "I'm just older, perhaps my blood pressure has dropped a little." And then they wait. Why do they do this? Because many older individuals are afraid of being perceived as weak, afraid of becoming a burden to their families, afraid that calling 911 might be an embarrassment if it turns out to be nothing serious, or afraid of disturbing their busy children. According to a survey by AARP, up to 61% of people aged 60 and older reported that they avoid calling their children when they feel unwell, unless they believe it is extremely serious. But the insidious nature of stroke is that by the time you feel it is very serious, it is often already too late to intervene effectively. I once spoke with a 72-year-old woman named Margaret, who lives alone in Florida. She recounted the first time she saw one side of her face droop in the mirror. She suspected something was wrong, but did not want to bother the neighbor to drive me to the hospital just for a little crooked mouth. She waited until the next morning to call her daughter. By the time she arrived at the hospital, the doctors informed her that she had missed the optimal window for treatment with clot-busting medicine. Just a few hours of waiting led to damage that lasted a lifetime. Sometimes silence does not stem from ignorance, but from a lifetime of being accustomed to enduring hardship alone. This deeply ingrained habit has tragically caused many to miss the invaluable chance to be rescued in time. Reason number 3. The mistaken belief that stroke must be painful to be serious. This is one of the most dangerous and widespread misunderstandings I encounter. Many people over 60 firmly believe that if there is no strong, excruciating headache, no sudden chest pain, no feeling like something is exploding inside their head, then it simply cannot be a stroke. So, when their face suddenly changes slightly, or they experience a fleeting difficulty speaking, they do not act. They rationalize that if it does not hurt, then it is probably nothing to worry about. But the truth is, the exact opposite is often the case. Stroke, surprisingly, frequently occurs without causing any pain whatsoever. According to the American Stroke Association, up to 65% of cases of ischemic stroke, which is the most common type, do not present with pain. The person remains awake, without a headache, without trouble breathing, and without dizziness, until a critical part of the brain simply shuts down because it is starved of oxygen. That is why many individuals experiencing their first stroke believe they are just tired or experiencing a slight facial cramp. There was a 74-year-old man in California who looked in the mirror one morning and noticed that his right eye was opening slower and his mouth looked a little uneven. Since there was no pain, he got dressed and went out for his customary morning walk. An hour later, when his arms and legs started to feel weak, he collapsed on the sidewalk, and a kind passerby called for help. By that time, nearly 90 minutes had passed, and the opportunity to use medicine to break the clot was almost entirely gone. If he had believed from the outset that stroke does not always cause pain, things could have unfolded very differently for him. Remember, stroke does not always hurt, and when the face changes, the person may not even be able to notice it on their own. This brings us to another reason it can be so hard to catch, and it is hiding right in the mirror they look at every morning. Reason number 4. Not noticing that the face has changed. This is a particularly insidious aspect of stroke. Many individuals having a stroke simply do not realize their face has changed. They might have a crooked mouth, unclear speech, or a drooping eyelid, yet genuinely believe everything about their appearance is normal. This condition is medically known as anosognosia, which essentially means the person is unaware that something is wrong with their own body. It is remarkably common in mild strokes or strokes that develop slowly. When the part of the brain responsible for self-awareness and facial expression is affected, the brain no longer has enough reflection or feedback to signal to you that your face looks different. This phenomenon is even easier to miss because the face is not something most people scrutinize closely throughout their day. Many of us simply glance at the mirror, quickly adjust our hair or shirt, and then move on. And if no one else points it out, small, subtle changes like a slightly bent mouth, a drooping eye, or a forehead that no longer wrinkles evenly are incredibly easy to overlook. A powerful example of this occurred with a 71-year-old man in California. During a morning video call with his son, the son suddenly noticed that his dad's mouth looked uneven, and his left eye did not open quite the same as the right. The man himself felt totally fine and was speaking normally. But thanks to his observant son noticing and immediately alerting other family members, they got him to the hospital in time and prevented serious brain damage. If that video call had not happened, a few hours later the stroke could have progressed too far to recover. This poignant story illustrates that when the person experiencing a stroke cannot see the change, their loved ones become the vital mirror that saves their life. But what if they live alone, with no one to remind them, no one to observe them? Then even a tiny change in the face might go completely unnoticed. And tragically, it often gets blamed on the usual dismissive reason. Just old age. That kind of thinking leads us directly to reason number 5. Reason number 5. Blaming it on age or temporary tiredness. Many older individuals, when they experience early signs of stroke like a crooked mouth, slightly slurred speech, or a drooping eye, immediately believe it is simply due to being tired, not sleeping well, or they dismissively say, "This is just what happens when you get old." The unfortunate truth is that after the age of 60, many small changes in the body are often too easily brushed off. One side of the face feels heavier, perhaps from sleeping on that side. A few unclear words, maybe because they have not had enough water yet this morning. Tightness in the left cheek, perhaps from walking a little too far yesterday. The inherent danger here is that these explanations sound entirely reasonable, and because they sound reasonable, both the person experiencing the symptoms and even their family members may choose to ignore the very real warning signs. According to the Centers for Disease Control and Prevention in the U.S., almost 30% of older adults who experience signs of a mild stroke thought it was just something normal, like stress or tired muscles. But stroke, my friends, does not wait for you to feel better. It relentlessly keeps moving forward, silently causing damage, even while you are resting to recover. In a report from emergency services in the U.S., 1 in 4 stroke cases arrived at the hospital too late because the person chose to wait before calling for help, thinking it's probably nothing serious. The important point to grasp is that after age 60, feeling tired can unfortunately become a common part of daily life, and that very pervasive feeling makes many people overlook the critical signs. They simply cannot differentiate between normal tiredness and the profound tiredness caused by the brain not receiving enough blood. That is why any small change on the face, even something as subtle as a weaker smile on one side or slightly different speech, should be looked at with immense care and suspicion. Because, do not ever forget, stroke does not care who is busy, who is tired, or who can still walk around on their own. Age is never an excuse to ignore a warning. But if no one is there to physically see those signs, then who will catch them in time? What happens when an older person lives alone and no one is watching? That brings us to reason number 6, no one around to observe from the outside. There is a worrying and increasingly prevalent fact that many people over 60 in the U.S. and Europe live alone. According to data from the Pew Research Center, around 27% of Americans age 60 and over live by themselves, not with their children or a partner. This number is even higher for those over 75. And when living alone, the risk of missing early stroke signs on the face increases dramatically. Because, as you now know, many of these crucial early signs, such as a drooping eye, a crooked smile, or unclear speech, are often only noticed by someone else looking at you, someone observing you from an external perspective. When there is no one around to observe, the person experiencing the stroke does not see the changes themselves, and, critically, no one is there to provide that vital warning. Everything passes quietly, unnoticed, and by the time the symptoms become undeniably clear, it is often tragically too late to save the damaged part of the brain. Some research has revealed that stroke patients who live alone take on average 110 minutes longer to reach the hospital compared to those who live with family. This means that a significant number of them miss the golden hour to receive the appropriate clot-busting medicine. I once read the case of a 78-year-old woman who lived alone in Illinois. She finally called 911 after 5 long hours because she felt numbness in her hand. However, she had no idea that her face had already changed significantly much earlier. Only when the medical staff arrived did they clearly observe the facial signs and confirm that the stroke had progressed considerably. Living alone does not mean you have to face these risks in silence. But even when there are people nearby, another profound barrier can make older adults hesitate: the deeply ingrained habit of suffering quietly. And this is the next reason why strokes can so easily be missed. Reason number 7, the habit of staying quiet and the maybe tomorrow mindset. Many older adults carry a deeply ingrained mindset that has, over decades, become a habit. Just endure it a little. It will pass. They have lived through wars, hardships, and countless challenges without complaining. They are accustomed to dealing with pain, fatigue, or feeling unwell without ever asking anyone for help. So, when they experience mild symptoms like slower speech, an uneven smile, or tightness in the face, they tell themselves, "Maybe I will feel better tomorrow." And that insidious, maybe tomorrow mindset has tragically caused many people to miss the golden hours for stroke treatment. According to a survey from the Cleveland Clinic, nearly 40% of older adults who experienced mild stroke signs admitted they wanted to wait and see, instead of calling for help right away. More than half of them arrived at the hospital more than 3 hours later, which is unfortunately past the optimal time for using clot-busting medicine. This habit of delaying does not solely originate from within themselves. Sometimes it stems from a profound reluctance for their children to worry, a desire not to bother others, or even an underlying fear of being told they are overreacting to something minor. Phrases like, "it will pass," or "maybe I ate something wrong," or resting will help transform into dangerous mental traps that prevent people from taking swift and decisive action. A stroke does not wait. The longer you delay, the more damage it quietly and relentlessly causes. Being quiet and enduring is an admirable quality in the difficult parts of life. But when it comes to a stroke, staying silent can mean losing your future, your independence, and your quality of life. And silence becomes even more perilous when you do not even know which signs you should be speaking up about. That brings us to the next critical reason. Reason number 8. Not knowing the early signs of a stroke. It is a fundamental truth that not everyone has been educated on how to recognize the signs of a stroke, especially the subtle and quiet changes that manifest on the face. And for older adults, this knowledge gap is even easier to miss because many people mistakenly believe that a stroke must invariably include dramatic symptoms like a severe headache, passing out, or full-body paralysis. Consequently, signs like slurred speech, a crooked smile, or eyes that do not open evenly are often erroneously perceived as not serious enough to warrant immediate attention. A survey from the Centers for Disease Control and Prevention showed that nearly 1 out of 3 Americans over 60 do not know that a crooked face or trouble speaking clearly are early, urgent signs of a stroke, and among those who live alone, this number is even higher. If you do not know, you do not suspect. If you do not suspect, you do not act. And that is why so many strokes that begin with the face are tragically not reported in time. The person incorrectly thinks they just have tired face muscles, or they are simply talking too fast, or tripping over their words. Some people even attribute these signs to a sinus problem or a sore tooth. The inherent danger here is that the smaller or milder the stroke, the quieter the signs. But this is precisely the best and most crucial time to act. If you lack the knowledge and therefore do not notice these subtle cues, then as time relentlessly passes, the brain is being damaged, bit by bit. Knowing these signs is not intended to make you scared, but rather to give you control, to empower you. No one is born knowing how to spot a stroke, but once you do, once you are armed with this knowledge, you will never look at your face, or the faces of your loved ones, the same way again. And if you still find yourself thinking, "Let me wait a bit longer and see," then reason number 9 will undoubtedly make you reconsider that dangerous thought. Reason number 9. Delay in calling for help and guessing what is wrong. Many older adults, when they notice something strange or concerning on their face, such as a drooping mouth, a sagging eye, or subtle trouble speaking, often choose to engage in self-diagnosis. They guess for themselves, thinking, "Maybe it's just low blood pressure," or "Perhaps I did not sleep well last night," or "Maybe I just caught a cold wind." Instead of calling 911 right away, they opt to lie down, drink some water, or wait a few hours to see if things improve on their own. And this, my friends, is precisely what causes them to lose the invaluable golden time for treatment. According to data from the American Stroke Association, nearly 45% of stroke patients arrive at the hospital more than 3 hours after their first symptoms appeared, simply because they believed it's not serious enough to call for help. Guessing what is wrong is an understandable human tendency, especially for older adults who often possess a wealth of life experience and have successfully dealt with many symptoms before, leading them to believe, "No one knows my body better than I do." But stroke does not follow predictable patterns. It does not look like common illnesses. And while you are trying to figure it out, while you are playing detective, the damage in your brain, or their brain, is still silently, relentlessly happening. Some research has revealed that among stroke patients with early signs on the face, those who arrived late at the hospital often search their symptoms on Google before calling for help. This highlights a dangerous trend. It is not just about delaying, but also about trusting technology, or self-information gathering, more than immediately calling for professional medical assistance. There is absolutely no online tool, no amount of self-diagnosis, more accurate or life-saving than calling for help and allowing a qualified doctor to check in person. Because with stroke, every single minute that passes means millions of brain cells are lost, and tragically, they cannot be repaired. You can look up all the information online, ask your neighbor for advice, or wait for your family to come home. But stroke does not wait, and sadly, it does not give you a second chance to guess again. That is why in the last part, I want to share the most important truth to help older adults stop missing these early, critical signs. This is not just knowledge. It is a way to protect life itself. Reason number 10. Not thinking it could happen to them. This is perhaps the deepest and arguably most dangerous reason of all. Many people simply do not believe that a stroke could happen to them personally. They still walk normally. Their blood pressure reading was perfectly fine yesterday. They still diligently exercise every morning and maintain a healthy diet. So, when their mouth suddenly droops slightly, they immediately think, "No way. I'm not someone who would ever have a stroke." This deeply ingrained way of denying personal risk is what causes many individuals to miss the first, most precious minutes to save their brain. According to research from the American Stroke Association, up to 36% of stroke patients once believed, "I'm still healthy, I can't be having a stroke," during the first 2 hours after their symptoms appeared. They did not call family, did not notify a doctor, and only acted when things became much more serious. But by then, something unfortunate, often irreversible, had already happened. I once read a case report about a 64-year-old woman who did not smoke, had excellent blood pressure, and had been eating a vegetarian diet for more than 10 years. She suddenly felt her mouth droop a little but attributed it to tiredness from gardening. She lay down to rest for 30 minutes, then fell asleep. When she woke up, she could no longer speak, and the part of her brain responsible for language was permanently damaged. Stroke does not pick the weak. Stroke does not wait for the busy. And stroke certainly does not send anyone a personal warning that your turn is coming. It arrives suddenly, quietly, and if you do not act correctly and immediately, the consequences can profoundly alter the rest of your life. Now, you understand why. So many people, especially older adults, ignore the clear, undeniable signs right on their own face. It is often not because they do not know what a stroke looks like in its later stages. It is because they never truly thought it could happen to them. And that is why the next part is extremely important, because it will help you translate what you know into what you do. Simple, real, actionable steps that could save your life or the life of someone you deeply love. If you have watched this far, I believe you are someone who genuinely cares. You care about your own health or the health of someone very close to you, a cherished loved one, a devoted spouse, a kind neighbor, or a lifelong friend. People who have walked with you through many ups and downs, and now, even a small change on their face could be an early, critical sign that a stroke is coming. And if you remember only one single thing from this entire video, please remember this. The face is the earliest warning sign of a stroke. Not chest pain, not fainting, not shortness of breath, but very small, subtle changes like a drooping mouth, one eye not opening quite the same, an uneven smile, or slightly slurred words. These are things that may seem harmless, but they are the first, most urgent signals that a part of the brain is not receiving enough vital blood. You do not need to be a doctor to recognize these signs. You just need to look, to notice, and, most importantly, to act. Because just a few hours late, that part of the brain can be damaged forever. And even if you survive, you may no longer be able to speak, to smile, to feed yourself, to hug your grandchildren one last time, or even recognize the beloved person sitting by your hospital bed. So, if you see any sign at all, even just one side of the mouth drooping slightly, speech that is unclear, or an uneven smile, do not guess. Do not start searching on Google. Do not wait until tomorrow morning. Call 911. Right then, immediately. If you live alone, Please print out a list of these facial signs and prominently display them on your bathroom mirror, on your refrigerator, or next to your phone. If you have an older loved one, please, I implore you, send them this video. That one message you share today could be the very reason they get help in time, on that unexpected day when no one expects it. Every day you still see that familiar, vibrant face is a day filled with hope and connection. But just 1 minute too late, that face may never smile the same again. Please act today, armed with this crucial knowledge before it is too late. If you found this video helpful, please do share it with someone you love today. Just one time they watch it could be the pivotal moment they recognize the signs of stroke before it is too late. And if you want to keep receiving clear, easy to understand, and truly important health messages like this, please click subscribe so I can continue walking with you like a trusted friend and guide. Because sometimes just one right message at the right time is enough to keep the precious smile on the face of someone you love.